Respected judges, delegates, and my dear friends, a very good morning to you all. The topic for my today's presentation is software-based binocular amblyopia therapy, a near advent in treatment of amblyopia. Is it a fact or a fancy? What is amblyopia? Amblyopia is unilateral or rarely bilateral decrease in the best corrected visual acuity caused by vision deprivation or abnormal binocular interaction for which there is no identifiable pathology of the eye or the visual pathway. It occurs when there is a breakdown in how the brain and the eye work together and the brain can't recognize the images from the eye. Amblyopia starts in the childhood and it is one of the most common cause of vision loss in children. The types of amblyopia basically being stimulus deprivation, meridional, strabismic, and mixed. What is the prevalence of amblyopia? The global value stands at 1.75%. The European office reports it at 3.67%. The African office reports it at 0.51%. The Indian prevalence values in 1997 study shows 1.10. In 2002 study shows 4.4. And 2015 study 6.6%. The pathophysiology of amblyopia basically revolves around the visual deprivation, which can be monocular, binocular, it can be light deprivation or abnormal binocular interaction. It is basically, the concept of amblyopia basically revolves around active cortical inhibition. This is a developmental defect of spatial visual processing occurring in the visual pathway. There is poor transmission from the fovea optic nerve to the striate cortex of the affected eye. Lateral geniculate body and the striate cortex also develop abnormally. The ganglion cells in the foveal areas are affected. There is shrinkage of the LGB nucleus and the striatal cortical fibers in the amblyopic eye. Diminution of binocularly driven cells in the LGB and the striate cortex. The diagnosis of amblyopia is mainly through the clinical history, binocular red reflex test, binocularity, stereo acuity testing, evaluation of the visual acuity fixation pattern, binocular alignment, ocular motility, pupillary examination, detailed fundus examination, cycloplegic retinoscopy refraction, neutral density filters, and looking for the crowding phenomenon. The present standard treatment modalities are the principles are to eliminate any obstacle to the vision, like the cataract, ptotic eyelid, correct refractive errors, force use of the poorer eye by limiting use of the better eye. The other treatment modalities being cycloplegic refractive correction, surgery to remove the stimulus deprivation, occlusion therapy, penalization, cortical stimulant medications like ceticolin, play optics, CAMP stimulator. Occlusion therapy is the gold standard for treatment. The principle is to enable the better eye to take fixation and to remove the inhibitory stimulus, thus helping in the cortical stimulation and development. It can be done up to 12 years of age, but it is best effective till 10 years of age. Patching duration is advised full day occlusion, but compliance, if the child is not compliant, at least 4 hours of daily therapy is done. So what after 12 years? Many adults are late diagnosed for refractive errors when they have already developed amblyopia and have crossed the age of visual plasticity. These adults were sometimes given occlusion therapy trial and sometimes counsel for the disease and explain poor visual prognosis. Here comes the software-based binocular vision therapy. For this study, we have used the ORC vision therapy software. This is an artificial intelligence-based vision therapy software to treat amblyopia. In ORC, there is a combined monocular and binocular exercises along with Gabor patch. The science behind it is random dot stereogram modules, dioptic principle, crowding phenomenon, anti-suppression technology, combination of monocular binocular exercises, individualized and customized contrast threshold, and Gabor patch exercises. The aims and objective of the study are to evaluate the visual outcome of software-based binocular amblyopia therapy in amblyops pre and post therapy. Importance of the study being, over the years there have been various treatment modalities that have been published, but none has been found to be very effective clinically. The binocular amblyopia therapy is another new therapy treatment modality on this horizon. So, is it a fact, fancy, or a gimmick? Methodology, area of study is Nanika Eye Care, Bardhaman. We had a sample size of 42 subjects of age group 12 to 45 years enrolled in the study. 4 were excluded due to poor compliance to therapy, which is less than 50% of therapy days. Inclusion criteria, patient diagnosed with amblyopia and undergoing ORC therapy, patients giving consent for the study. Exclusion were patients with recent ocular diseases, treatment within last 1 month, patients with any ocular pathology other than amblyopia, patients not giving consent for the study. The method followed was preliminary examination,
Doctor,
visual
can you
acuity on
conclude now?
Snell's.
Please conclude. The time is
Yes.
over.
The slit lamp examination, statistical analysis was performed. Results: male were 64%, females 35.7%. This was the age distribution in the study. This was the pre-treatment visual acuity. The most of the subjects were between 624 to 660. Visual improvement of 1 month within 1 month of therapy was seen in 2 Snell's line improvement. At least 2 Snell's line improvement was seen in 78.9%, while none of the subjects showed no improvement. Subjects attained 6/6 vision in 1 month of therapy were 4, 2 months of therapy were 14, 3 months were 8, more than 3 months continued therapy was 14. All study subjects of varied age groups showed some improvement in visual acuity in 1 month of therapy. 78.9% showed.
Dr. Sarkar, conclude.
Binocular amblyopia therapy shows promising and encouraging results with good visual recovery from first month of treatment itself. Only few individuals complained of initial headache, which resolved over the counter analgesics. Thank you.
Excellent one, but we could not complete your talk completely. We missed some things. So what do you suggest? Is it useful to the people?
I have found it in my study. I have found it to be a useful tool because in all the patients I have used, I have found some visual recovery in at least 1 month of therapy. Most of the patients showed 2 Snell's line of recovery within 1 month of therapy, while some showed 1 Snell's line and few showed more than 2 Snell's line recovery.
Yeah, what is the recommended duration of therapy and the cost of therapy?
Madam, the cost of therapy is as per the company. They provide 3 modules for the therapy. For the 1 month therapy, they are charging 2,800. This is from the hospital they charge. The hospital can charge whatever they want from the patient. For 2 months, for 3 months, I think it is 5,000. For 6 months, it is 9,000. And the therapy, duration of therapy is generally I start with a single month of therapy and then I proceed till the patient attains 6/6 vision.
So what is the frequency and is there any dwindling after the therapy stops? Like
No, madam, I haven't followed up all the patients. This is a 3 months of study. The patients are still under my follow-up. I haven't seen any patient reducing their visual acuity or losing the gained visual recovery. But I should do a longer follow-up to come up with definite results.
thank you.
Thank